Kathy, if you read the Buffalo News, it's right in your face. It's right in our face nationwide. What is the best practice now for politicians to contain the great hospitalization we're seeing?
Well, we have a strategy, Tom, and thank you, everyone, for having me back on this once again. Western New York, where I live, Erie County, Buffalo, we now have a 9.4% infection rate, and that's up from just 2.5%, 3% over a month ago. So I want to just point out, first of all, these numbers can spiral out of control very quickly. And what that does, it's an infection rate that leads to an increased number of hospitalizations. And that is our greatest fear. Governor Cuomo and I have said this from the beginning. Our fear is overwhelming the hospital system. So what we're doing is, first of all, calling back retired nurses and doctors, asking them to enlist again and help us in this battle, but also asking every single hospital to ensure that they have 50% surge capacity. We had to do this in the spring. We know how it's done, and we can do this once again. Thirdly, we also want to make sure they have enough protective equipment. Remember how frightening it was back when March and April we were scouring the planet in search of something as simple as a mask. We couldn't get them from anywhere. So we're making sure they have those supplies. But something we can't control, which is very frightening, the staffing. The staffing now, these are individuals who've been in this battle and the front lines of this horrific war for months. They're exhausted. Many of them are sick themselves. Many of them don't want to expose their family members any longer. And that is where we're having a real crisis point. And early on, we were able to enlist 30,000 people from across the country who volunteered their time to come to the epicenter of the pandemic, New York City. Those people are now needed in their homes in North Dakota, South Dakota, and Oklahoma, and places where it's surging there as well. So that's what we're concerned about. We can create enough beds. We can put up field hospitals if we have to, but we have to make sure that they're properly staffed.
That's the incredible stress on the healthcare system that we're seeing across the nation and increasingly yet again in New York. From the financial perspective, there is a question of how much money is needed, how soon. And I know you've come on the show quite a bit and talked about the needs financially for New York State. Mitch McConnell currently putting out a skinny bill to get done before the end of the year that would not include funding for your government in New York State or other local governments. My question is, how imminently do you need that money? If you do not get it before the end of the year, what gets cut first?
We needed this money yesterday, and I still do not understand for the life of me how Mitch McConnell and the Senate Republicans can be so stingy. This is a once in a 100-year event. It is a global pandemic, and I don't even know how they think we're going to get the vaccinations out, how they're going to get the vaccines distributed if they don't give us money. Governor Cuomo is head of the National Governors Association, a bipartisan group. Yesterday, they sent a letter saying to the federal government, we need money to be able to distribute. You're not going to do it nationwide. Okay, fine. You didn't help us with the testing. You left us on our own throughout this entire pandemic. Well, you have to give us money to make up for the loss in revenues and the way we've been having extraordinary expenses. So, Lisa, I'm not going to say here what has to be cut. All I know is it's not acceptable, and everyone should be rallying to convince the Republicans and Mitch McConnell, do this for this country. If we don't get this crisis under control, our economy is going to implode. Conversely, if we can wrap our arms around this, get enough money to the states like New York so we can have mass vaccination as soon as it's humanly possible, we can supercharge our economy once again, and that's what everyone wants.
Lieutenant Governor, a couple of things to unpack here. One, are you saying that without state aid from the federal level, you can't distribute this vaccine?
No, I didn't say that. I'm just saying that we desperately need money to have a robust, aggressive plan. We will do it. This is New York. We'll figure it out. We are left on our own throughout this entire pandemic. It's unfortunate, and it never should have been that way. We should have had a national response to this crisis, but we didn't. Failure of the federal government, failure of the Trump administration. So the governor and I have been working on this. We're ready for this. We can handle this. But it's going to be very expensive to get this vaccination out distributed to literally 20 million people, not once, but twice. And that's the challenge that we're facing. So the reality is, we want to keep funding, we want to keep paying for health care workers and people to do that. We need money from the federal government. We need their help.
I understand you're urging Leader McConnell to come to the table. Have you urged Speaker Pelosi to do the same thing, who, for many people, is perhaps aiming a little bit too high, particularly over the last couple of months going into the election?
I don't know what is too high during a global pandemic. These are extraordinary costs. We're not asking them to help us balance our annual budget. We have had to incur costs that no one ever could have foreseen when they did their budgeting. And now it's not just the blue states. Remember Mitch McConnell said, why would we bail out the blue states, meaning New York, California, Connecticut, New Jersey? Now it is a national phenomenon, and we need them to assist every state because this is going to hold back our economy. And one of the problems we have is that small businesses in particular, and I toured the southern tier west of New York yesterday to visit small businesses, they are barely clinging on for life. And the programs that helped them before, the unemployment program from the federal government that assisted businesses as well, business owners, as well as for their employees, that's all going to expire within weeks. When that money's gone, who do you think is going to be doing the consumer purchasing we need to keep our economy going? It's going to all dry up.